Hello, I'm Emmy Hughes. I'm faculty in the Department of Population, Family, and Reproductive Health. One of the initiatives we have in the department is to develop a science of families and public health. Military families are an excellent example of the overlap between families and health. We like to think of families as both a conduit and a context for health. Military families exemplify this. On the one hand, military families, that is, families that have one or more members in the military, are subject to national security policies and the workings of the military bureaucracy. So, military members are deployed, the families move according to the needs of the military. These contextual effects are then filtered to individual members of the family, as the family provides a context for these individuals' daily lives. Military families are both uniquely challenged and also uniquely resilient. The Military Child in Hawaii study, on which I participated with Bob Blum, Michael Blum, and Kristen Mari, was funded by the Pacific Command, PACOM, to study the well-being of military families in Hawaii with school-aged children. It's a mixed method study, that is, we conducted a survey and a large set of focus groups. It includes both parents and children. Our initial work focused on the educational experiences of the children in the families, because this was the mandate from PACOM. Since then, we've also focused on deployment. As you see in this slide, the families in this study have experienced a very high level of deployment, and many families have experienced multiple deployments. We have done work on the deployment cycle, that is, the ways in which families experience the stages of deployment, getting ready, the actual deployment, and reintegration. We've also done some work on the factors that enable the non-deployed parent, that is, the parent on the home front, to cope with the absence of the other family member. These findings point to some important interventions for military families.